Zika virus is a flavivirus. It's an infection that's carried by mosquitoes, and it causes an illness that's usually very mild. It can even be asymptomatic. One of the reasons that the Zika virus is of so much concern lately is not from the infection itself, but of the late consequences, particularly in pregnant women. So this is what has caused the largest degree of concern. Congenital abnormalities that have been linked to infection of pregnant women with Zika virus, and that has later effects on the fetus. In terms of a vaccine, we don't have a vaccine for this disease either, but there are several candidate vaccines that are in research stages right now, and we're hopeful that perhaps within a year or so we'll have some clinical trials going with vaccines to prevent this disease. So at Johns Hopkins Medicine, we are well positioned to address many aspects of infectious disease threat like the Zika virus. For instance, at the Bloomberg School of Public Health, we have many researchers who are doing vaccine development research on similar diseases like dengue, and these efforts could be repurposed to develop vaccines for Zika virus infection to prevent the infection. From a patient care perspective, we also have infrastructure in place to screen our patients for recent travel. So I think when facing any infectious disease threat like the Zika virus, it's important to remain calm and to arm ourselves with the facts. And the Centers for Disease Control and Prevention is an excellent resource to get information and to stay abreast of the current advisories and recommendations to protect ourselves.
Today, we're looking at the symptoms, diagnosis, and treatment of Zika. Anyone who lives in or travels to an area with Zika and has not already had the virus can become infected with it. In many cases, Zika doesn't cause any symptoms or causes only mild symptoms that last several days to a week. Hospitalization is uncommon. Typical symptoms include fever, rash, joint pain, and red eyes. Some people will also have muscle pain and headaches. If you've traveled to an area with Zika and experienced these symptoms, schedule an appointment with your doctor or other healthcare provider to see if you have Zika. Diagnosis of Zika is based on your recent travel history, symptoms, and a blood or urine test. Your doctor or healthcare provider may also test for similar diseases like dengue or chikungunya. Right now, there is no medicine or vaccine for Zika virus. If you develop Zika symptoms, make sure you rest, drink fluids to prevent dehydration, and take acetaminophen found in products like Tylenol to reduce.
Here are effective steps you can take to protect yourself, your family, and your community from the spread of Zika virus. Cover and repel. Remove collected water. Keep mosquitoes out of your home. And, if you're pregnant and have sex, use condoms. All of these actions are necessary. Taken together and repeated as recommended, these steps will help protect you, your family, and your community from getting Zika. Cover and repel to keep mosquitoes from biting you. Wear long-sleeved shirts, long pants, and socks, apply mosquito repellent, and sleep under a bed net and cover cribs and strollers with mosquito net. Remove containers that collect water to eliminate places where mosquitoes can rest and lay eggs. Empty collected water at least once a week and scrub containers to remove mosquito eggs. Cover containers so they don't collect water when it rains. Throw away trash or unused containers with collected water. Keep mosquitoes out of your home. Use screens on windows and doors. Once a week, empty and scrub all containers inside your home that hold water, like vases or flower pot saucers. And use an indoor flying insect fogger or spray insecticide to kill mosquitoes. Zika virus stays in the body for a while and can be sexually transmitted by a man to his sex partner through semen. If you're pregnant, Zika can harm your pregnancy. If you are pregnant, use a condom every time you have sex with a male partner during your pregnancy. Use a condom the right way to prevent the spread of Zika virus. Using a condom can protect your pregnancy. If you're not pregnant and not trying to get pregnant, talk to your healthcare provider about effective contraceptive measures. Zika can be scary. Remember, you can take steps to protect yourself, your family, and your community from the spread of Zika virus. Cover and repel. Remove collected water. Keep mosquitoes out of your home. And if you're pregnant and have sex, use condoms. For more information, go to cdc.gov/Zika.
Not everyone will get symptoms. It's pretty common with viruses like this that many people who are infected don't ever show any symptoms. So it is important for people, if they have potentially been exposed, to take precautions, especially if they have a partner that's pregnant.
Zika virus can be transmitted through mosquito bites or sexual contact. Infected babies may suffer from microcephaly, affecting their growth and intellectual ability and requiring lifelong care. The virus can also cause neurological complications, such as paralysis or respiratory difficulties. Death may occur in severe cases. Everyone should take precautions to protect themselves from getting Zika virus.